the silent enemy, cancer in your golden years. As we grow older, life begins to change in subtle yet profound ways. The mornings feel slower, the energy less abundant, and the body seems to remind us constantly that time has passed. We accept aches, fatigue, and occasional discomfort as part of aging. After all, isn't that just what happens when you reach your 60s, 70s, or beyond? But what if some of those seemingly harmless changes were something more, something dangerous, even deadly? Here's a hard truth. Nearly 60% of all cancers occur in people aged 65 and older. This isn't just a statistic. It's a reality millions of seniors face every year. And while medical advancements have made incredible strides, one thing remains painfully clear. The earlier cancer is detected, the better the chances of survival. According to data from the National Cancer Institute, patients whose cancer is caught in its earliest stages have an over 80% chance of surviving at least 5 years. That number drops dramatically, sometimes as low as 20% or lower, when cancer is discovered too late. Why such a stark difference? Because in the early stages, cancer is usually localized, meaning it hasn't spread far from where it started. At this point, treatment options are wide open: surgery, radiation, chemotherapy, immunotherapy, all of which stand a much greater chance of success. But once cancer spreads, once it moves silently through the bloodstream or lymph nodes, the battle becomes harder, the odds shift, and the choices narrow. And here's the scariest part. Cancer doesn't always shout. Sometimes it whispers. In its earliest phases, cancer rarely announces itself with dramatic pain or obvious symptoms. Instead, it hides behind the mask of normal aging. Fatigue? Oh, that's just getting older. Night sweats? Probably hormonal. Persistent heartburn? Just indigestion. Bone pain? Must be arthritis. That's exactly how it works, and why so many seniors miss the warning signs until it's too late. We created this guide because we believe you deserve to know the truth. Not just the facts, but the real story, the one no one wants to talk about, but everyone needs to hear. Because knowledge isn't just power, it's protection. And in the fight against cancer, awareness could mean the difference between life and death. So let's take a closer look at the 8 silent signs of cancer that many seniors overlook. These aren't the obvious red flags like lumps or severe weight loss. No, these are the sneaky, deceptive signals your body might already be sending, but you haven't recognized yet. We'll count them down from number 8 to number 1, explaining what to look for, what it could mean, and what you should do next. And then, because knowledge alone isn't enough, we'll reveal 3 powerful foods backed by science that can help protect your body and reduce your risk. Not just delay the inevitable, but actively strengthen your defenses. This is more than just health advice. This is a wake-up call, a gentle nudge to pay attention to your body, to trust your instincts, and to never dismiss a symptom simply because you think it's just age. Your golden years should be filled with joy, peace, and freedom, not fear or regret. But that only happens if you take action now. So ask yourself, are you truly listening to your body? Are you giving it the care and attention it deserves? Could something you've been ignoring actually be a sign of something bigger? Because if you're over 60, cancer could already be hiding in plain sight. Let's find out together. The 8 sneaky signs, what your body is trying to tell you. Symptom number 8, persistent heartburn. It starts as a whisper. You're sitting at the dinner table, enjoying a warm meal with family, or maybe just a quiet evening alone. Afterward, you feel that familiar burn behind your breastbone. Nothing new. You brush it off. It's probably that spicy sauce or the extra glass of wine. You take an antacid and go to bed. But over time, the heartburn doesn't go away. It comes more often. Sometimes it wakes you up in the middle of the night. Food feels like it's getting stuck. You start needing those pills every day just to feel normal. And still, you tell yourself it's nothing serious. Just part of aging. What if I told you your body is actually sending you a warning? Heartburn is one of those symptoms we all know, and most of us ignore. But when it becomes persistent, especially after age 60, it could be more than just indigestion. It could be your digestive tract quietly crying out for help. A burning truth, when heartburn isn't just heartburn. Let's get scientific for a moment, but keep it simple. Your esophagus isn't built to handle stomach acid. That burning sensation you feel? That's acid from your stomach creeping up into the tube that connects your mouth to your gut. If this happens occasionally, like after a big meal, it's totally normal. But when it becomes chronic, happening multiple times a week, waking you up at night, making it hard to swallow, that's when things start to get dangerous. Because here's what happens inside your body. Every time acid splashes back into your esophagus, it damages the delicate lining. Over time, the cells begin to change. This condition is called Barrett's esophagus, and it's a known precursor to esophageal cancer, a particularly aggressive form of cancer that's often diagnosed too late. And here's the scary part. Barrett's esophagus doesn't always hurt. In fact, some people don't even feel heartburn anymore once the lining has changed. So while you think your digestion is improving, your risk of cancer may actually be rising. Why seniors are especially vulnerable. As we age, our bodies slow down. Our muscles weaken, including the muscle at the bottom of the esophagus that keeps stomach acid where it belongs. That means seniors are more prone to chronic acid reflux without realizing it. Add in medications like blood pressure pills, antidepressants, or painkillers, many of which can relax that muscle or irritate the stomach, and the stage is set for long-term damage. Many seniors simply accept heartburn as part of life. They adjust their diets, prop up pillows, and pop pills without thinking twice. But what they don't realize is that they might be silencing a critical alarm system. Real stories, from just indigestion to cancer diagnosis. Let me tell you about John, a retired teacher from Florida. For over a year, John dealt with constant heartburn. He tried everything: over-the-counter meds, cutting out coffee, sleeping on 2 pillows. Nothing worked. His doctor told him he had GERD, gastroesophageal reflux disease, and that was that. But then came the swallowing problems. Food started feeling like it was getting stuck halfway down. He lost weight without trying. Finally, after months of ignoring his instincts, John agreed to an endoscopy. The results were devastating. Esophageal cancer, already at stage 2. He didn't cry. He just sat there, stunned. How could something so small, a little heartburn, turn into this? If only he'd listened earlier. What to watch for, the red flags. So how do you know when heartburn crosses the line from harmless to dangerous? Here are the signs you should never ignore. Heartburn that lasts more than a month, even with medication. Difficulty swallowing or food getting stuck. A hoarse voice in the morning. Chest pain unrelated to physical activity. Frequent coughing or sore throat. Weight loss without trying. These aren't just signs of aging. They're signs that something deeper might be going on. What happens next? Getting answers. If you've been struggling with heartburn for weeks or months and it won't go away, talk to your doctor. Don't accept a quick fix with pills. Ask for a referral to a gastroenterologist. They may recommend an endoscopy, a procedure where a small camera is inserted through your throat to look directly at the lining of your esophagus. If anything looks suspicious, they'll take a biopsy to check for abnormal cell changes. This is not something to delay, because catching Barrett's esophagus early can prevent cancer entirely. And catching esophageal cancer in its earliest stages gives you a fighting chance. What you can do right now. If you're experiencing persistent heartburn, stop self-medicating blindly. Antacids are fine for occasional use, but daily reliance is a red flag. Keep a symptom journal. Track when the heartburn happens, what you ate, how long it lasts, and any other symptoms like difficulty swallowing or chest discomfort. Talk to your doctor. Be specific. Don't say, "I have heartburn." Say, "I've had heartburn almost every night for the past 3 weeks, and it doesn't improve with lifestyle changes." Make dietary changes. Avoid fatty foods, alcohol, chocolate, peppermint, and carbonated drinks. Eat smaller meals and avoid lying down right after eating. Elevate your head while sleeping. Use a wedge pillow or raise the head of your bed by 6 to 8 inches. Final thoughts. Listen to the burn. Persistent heartburn isn't just uncomfortable, it's potentially deadly. It's easy to dismiss because it's common. But when it lingers, when it disrupts your sleep, when it makes eating a chore instead of a pleasure, it's time to pay attention. Your body is speaking. Are you listening? In the next section, we'll uncover another surprising sign you might never associate with cancer: eye pain or vision changes. Stay with me, because knowledge is power. And in the fight against cancer, awareness could save your life. Eye pain or vision changes, when your eyes whisper danger. Have you noticed something strange with your eyes lately? Maybe it's a dull ache behind one eye that won't go away. Or perhaps things look slightly distorted, like the edges of objects are warped or hazy. Maybe you've started seeing floaters or flashes of light at night. Most people assume these changes are just part of getting older. After all, vision naturally declines as we age. Cataracts, glaucoma, macular degeneration, they're all common concerns for seniors. But what if I told you that sometimes these symptoms aren't just about aging? What if they were your body's way of sending an urgent message? One that had nothing to do with your eyes and everything to do with something much more serious. Because believe it or not, eye pain or sudden vision changes can be early signs of cancer. Not just eye cancer, but also cancers that have spread from other parts of the body. And here's the terrifying truth. Many seniors ignore these signs until it's too late. The silent messenger, how cancer speaks through your eyes. You wouldn't expect your eyes to warn you about lung cancer or breast cancer. But in some cases, they do. Certain types of cancer, like ocular melanoma, lymphoma, or even metastatic cancers, can affect the structures inside your eye or the nerves connected to them. And when they do, your vision becomes the first place where trouble shows up. Unlike typical age-related vision loss, which happens gradually and predictably, cancer-related eye changes often come on suddenly, and they don't improve with glasses, eye drops, or rest. They might start subtly, a new blind spot in your vision, seeing flashes of light or floating specks. Objects appear distorted, like looking through water. One eye feels pressure or pain, especially at night. Double vision without a clear cause. Blurred vision that doesn't get better. These symptoms may seem minor at first. You might shrug them off as fatigue or normal aging. But when they persist, when they don't go away, they could be signaling something far more dangerous than poor eyesight. Why cancer can hide in your vision. Let's talk science, but keep it simple. The eye is a complex organ filled with blood vessels, nerves, and pigment-producing cells. Because of this, it can be affected by different kinds of cancer. Ocular melanoma. A melanoma, this rare but serious form of cancer, starts in the pigment cells of the eye. It often begins in the uvea, the middle layer of the eye, which makes it hard to detect without specialized tools. Metastatic cancer. Some cancers, especially breast cancer and lung cancer, can spread to the eye. When this happens, it's called metastatic ocular cancer. The tumor may grow on the retina or optic nerve, causing visual disturbances long before other symptoms show up. Lymphoma of the eye. Intraocular lymphoma. This is a type of non-Hodgkin lymphoma that affects the vitreous fluid inside the eye. It can mimic inflammation or infection, making it easy to misdiagnose. Optic nerve tumors. These can compress the nerve that connects the eye to the brain, leading to vision loss or distortion. The scary thing? None of these conditions typically cause dramatic pain, at least not at first. Instead, they whisper their presence through small, confusing changes in how you see the world. Why seniors are more vulnerable. As we age, our bodies become more vulnerable to cellular mutations. That's why cancer rates rise after 60. At the same time, seniors often experience natural changes in vision, dry eyes, cataracts, presbyopia, that make it easier to miss the red flags of something more serious. Many seniors also rely on over-the-counter eye drops or home remedies instead of seeking professional help. They may avoid going to the doctor because of mobility issues, fear of bad news, or the belief that nothing can be done anyway. This mindset is dangerous, because unlike cataracts or dry eyes, cancer-related vision problems don't stabilize. They worsen, and once the cancer spreads beyond the eye, treatment becomes far more difficult. Real stories, from just getting older to a life-changing diagnosis. Let me tell you about Marilyn, a retired school nurse from California. For months, Marilyn noticed her right eye was acting strangely. She saw occasional flashes of light and had trouble reading fine print. She thought she needed new glasses. Her optometrist prescribed lenses, but the problem didn't go away. Then came the headaches. Dull, persistent pain behind her right eye. She tried warm compresses, eye drops, even meditation. Nothing worked. Finally, she visited a specialist. An MRI revealed a mass pressing against her optic nerve. Further tests confirmed it was a metastatic tumor from lung cancer that had quietly spread to her eye. Marilyn never smoked a day in her life. She ate healthy, exercised regularly, and took care of herself. But cancer found her anyway, and almost went unnoticed until it was nearly too late. If she hadn't trusted her instincts and sought a second opinion, the story could have ended very differently. What to watch for? The red flags of eye-related cancer. So how do you know when vision changes should raise alarm bells? Here are the warning signs you should never ignore. Sudden appearance of floaters or flashes in one eye. Distorted or blurred vision that doesn't improve with glasses. Dark spots or shadows in your field of vision. Pain or pressure behind the eye without injury. Double vision with no known cause. Changes in the shape or color of the iris. A white glow in the pupil, especially visible in photos. Loss of peripheral vision without explanation. These symptoms don't always mean cancer, but they should never be ignored, especially if they persist for more than a few weeks. What happens next? Getting answers fast. If you notice any of these symptoms, don't wait. Make an appointment with an ophthalmologist, not just an optometrist. Unlike general eye doctors, ophthalmologists are trained to diagnose and treat diseases of the eye, including cancer. They may perform dilated eye exams to check the retina and optic nerve, ocular ultrasounds to detect tumors inside the eye, fluorescein angiography to examine blood flow in the retina, MRI or CT scans to rule out tumors outside the eye. Early diagnosis is crucial. In the case of ocular melanoma, catching it early can preserve both vision and life. Delayed diagnosis, however, can lead to blindness, or worse, the cancer spreading to other organs. What you can do right now. If you're experiencing unexplained eye pain or vision changes, don't self-diagnose. Don't assume it's just dry eyes or needing a new prescription. See a specialist. Ask specifically for an ophthalmologist who has experience with ocular oncology. Keep a symptom log. Note when the changes happen, how often, and whether anything makes them better or worse. Ask questions. If your doctor dismisses your concerns, ask for further testing or a second opinion. Stay informed. Knowledge is power. Learn the signs so you can advocate for yourself. Final thoughts. Listen to what your eyes are saying. Your eyes don't lie. When they start showing signs of trouble, especially if those signs don't match what you'd expect from aging, it's time to pay attention. Cancer doesn't always announce itself with pain or drama. Sometimes, it hides in plain sight, whispering through subtle changes in how you see the world. If you're over 60, don't let fear or denial stop you from taking action. Your eyes might be trying to save your life. In the next section, we'll explore another surprising early sign of cancer. Changes in your stool. Yes, talking about your bowel movements can literally be a matter of life or death. Strange or new stool changes. When your bowels whisper danger, you know your body better than anyone. You wake up in the morning, do what you've done every day for decades, go to the bathroom. But something feels off. The color of your stool looks different. Maybe it's pale like clay, or black and tarry like asphalt. Or maybe its shape has changed. It's narrow, almost ribbon-like. You shrug it off. You think, maybe I ate something weird last night. Or, I'm getting older, things just don't work like they used to. But what if your gut is trying to tell you something more? What if your bowel movements are giving you a quiet warning? One that could mean the difference between life and death. Because here's a truth most people never consider. Your stool can be one of the earliest indicators of cancer, especially colorectal, pancreatic, or liver cancer. And yet, most seniors ignore the signs until it's too late. The language of your gut, how your body speaks through poop. Let's get real for a moment. We don't like to talk about it. It's not dinner conversation. But the truth is, your digestive system is one of the most honest parts of your body. Unlike your heart or lungs, which can quietly fail without obvious symptoms, your gut often sends clear messages when something's wrong. One of the clearest messages? Changes in your stool. Color, shape, frequency, texture. These aren't just quirks of digestion. They're signals. And when they change suddenly or persistently, they may be telling you that something deeper is going on. Here's how cancer can speak through your poop. Red flags in your stool, what to watch for. If you're over 60, these changes should never be ignored. 1. Pale or clay-colored stool. This can signal a blockage in your bile ducts. Bile gives stool its brown color. If it can't flow normally, your stools turn pale. A common cause? A tumor in the pancreas or liver pressing on the bile duct. 2. Black, tarry stool melena. This usually means there's bleeding in your upper gastrointestinal tract, like the stomach or esophagus. While ulcers or medications like aspirin can cause this, it can also point to cancers in the stomach or esophagus. 3. Bright red blood in stool. This indicates lower intestinal bleeding. Hemorrhoids are common and usually harmless, but persistent blood could also indicate colon or rectal cancer. 4. Narrow or ribbon-like stool. This happens when a mass in the colon or rectum narrows the passageway. It's a classic sign of colorectal cancer and shouldn't be dismissed as constipation. 5. Persistent diarrhea or constipation. Going back and forth between diarrhea and constipation can signal an obstruction. If this pattern lasts more than a few weeks, especially with other symptoms, it's time to dig deeper. 6. Unusual smell or greasy appearance. If your stool floats and smells extremely foul, it might mean your body isn't absorbing fat properly. This can happen with pancreatic cancer, where the pancreas stops producing enzymes needed for digestion. Why seniors often miss the signs. As we age, our bodies go through natural changes. Digestive issues become more common. We blame lactose intolerance, medications, or just getting older. But cancer doesn't always announce itself with pain or drama. It sneaks in quietly, through subtle shifts in how your body functions. Many seniors assume their changing bathroom habits are normal. They self-treat with fiber supplements, laxatives, or probiotics without ever considering the bigger picture. The danger? These symptoms can mask serious conditions like colorectal cancer, the second leading cause of cancer deaths in the U.S. Pancreatic cancer, known as the silent killer because symptoms often appear late. Liver cancer can begin without pain but show early signs in digestion. Gallbladder or bile duct cancers, often missed until advanced stages. Real stories, from just my gut to a life-saving diagnosis. Meet Eleanor, a retired librarian from Oregon. For months, Eleanor noticed her stools were oddly shaped, narrow, almost flat like a ribbon. She thought she was constipated. She tried prune juice, fiber bars, even a new water routine. Nothing worked. Then came the bloating. She felt full all the time, even after small meals. Her appetite dropped. She lost weight unintentionally. Still, she didn't think much of it until she saw blood. At first, she assumed hemorrhoids. But when the bleeding continued and the ribbon stools persisted, she finally made an appointment with her doctor. After a colonoscopy, the news was devastating. Stage 2 colorectal cancer. She had no family history. She exercised regularly. She ate healthy, but she had ignored the signs her body was sending. Thankfully, she caught it early enough for surgery and treatment. Today, she's cancer-free. Her message? Don't wait for pain. Don't wait for weight loss. Listen to your gut, literally. What happens inside your body? The science behind the symptoms. Let's break down what happens when cancer affects your digestive system. Colorectal cancer starts as polyps in the colon or rectum. As the tumor grows, it can narrow the passage, causing ribbon-like stools. Bleeding occurs when the tumor erodes blood vessels. Pain is often absent until later stages. Pancreatic cancer often begins in the head of the pancreas, near the bile duct. Blocks bile flow, causing jaundice and pale stools. Interferes with enzyme production, leading to greasy, foul-smelling stools. Early symptoms are vague: fatigue, weight loss, abdominal discomfort. Liver cancer may begin silently, with no pain or obvious symptoms. Can cause dark urine and pale stools due to impaired bile processing, often linked to long-term hepatitis or cirrhosis. Bile duct cancer, rare but dangerous, causes yellowing of skin/eyes, itching, and pale stools. Often misdiagnosed as gallstones or indigestion. What happens next? Getting the answers you need. If you notice any unusual changes in your stool that last more than 2 weeks, talk to your doctor immediately. Don't accept a quick diagnosis of IBS or dietary sensitivity without further testing. Ask for specific tests, such as colonoscopy, to look directly inside the colon and rectum, CT scan or MRI, to check for tumors in the abdomen, stool tests, to detect hidden blood or infection, blood tests, including liver function tests and tumor markers like CEA. Keep a stool journal. Track color, shape, consistency, and frequency. Bring it to your appointment. It helps doctors spot patterns. Get a second opinion. If your symptoms persist and your doctor dismisses them, seek another specialist. What you can do right now. If you're experiencing unexplained changes in your bowel habits, don't delay. Early detection saves lives. Don't Google alone. Use reliable sources like the American Cancer Society or Mayo Clinic. Eat high-fiber foods. Whole grains, vegetables, and fruits support digestive health. Stay hydrated. Water helps regulate digestion and flush toxins. Know your family history. Some cancers run in families. Ask questions. Final thoughts. Listen to the message in your gut. Your body speaks constantly. It tells you when you're tired, hungry, thirsty, or stressed. Sometimes, it whispers warnings through small, strange changes that seem insignificant at first glance. A pale stool, a ribbon shape, unexplained blood, a sudden shift in bathroom habits. These aren't just annoyances. They're clues. And sometimes, they're your only chance to catch cancer before it spreads. If you're over 60, don't let fear or denial stop you from acting. Your gut might be trying to save your life.